Welcome to You and Your Health. My name is Dr. David James. Today's topic is plastic surgery. Plastic surgery has always been glamorized as a way to make you look younger and more beautiful. You can reshape various parts of your body in order to achieve the desired results. You can inject substances to eliminate wrinkles. You can insert prosthesis to shape and contour various parts of your body. However, this is only one aspect of the specialty of plastic surgery. Our guest today is Dr. Robert Swartz. Dr. Swartz is a board-certified plastic surgeon who was in plastic surgery in Chicago for many years. Dr. Swartz, would you please tell us a little bit about yourself?
Well, I practice plastic surgery in Chicago, both cosmetic and reconstructive surgery, so that the breadth of my practice was very wide. I enjoyed both and have been retired now for 15 years and for the most part been living in Ballin Isles on and off since that time.
How wonderful. What is the specialty of plastic surgery and what training is involved? What training did you have to go through to become a board-certified plastic surgeon?
Well, my training may not be typical, although it was pretty typical during the era in which I went through the training. I spent 5 years as a resident in general surgery and then practiced in the Air Force for 2 years. And then after getting out of the Air Force, I spent 2 years in a plastic and reconstructive surgery residency and then went into private practice. Not all of that training is required, but between 3 and 5 years in general surgery or a surgical specialty before a 2 or 3 year residency in plastic surgery is today, I believe, the norm.
And board certification?
Board certification is by the American Board of Plastic Surgery. It involves a written and then an oral examination like most of the boards do. There are other specialties that overlap plastic surgery. There are procedures which otolaryngologists do on the face, which are cosmetic and even reconstructive. And there's some procedures which dermatologists do, injecting various fillers and such as that, which overlap plastic surgery. But for a plastic and reconstructive surgeon, it's a combination of training in a specialty like general surgery, for example, and then further training in plastic surgery.
It's many, many years above medical school.
Yes.
The broader aspect of plastic surgery, beyond cosmetic surgery, we all know about the Hollywood embellishments and all that, but what is there more to it than just the injections and the contouring?
Well, there's reconstructive surgery, for example, of infants with cleft lip and palate, and that can go on in many stages for many years to get the patient where we want them to be and where they want to be. There's surgery to reconstruct after burns injuries and after deformities from burns. There's head and neck cancer surgery and the reconstruction of that. And then, of course, post-mastectomy reconstruction, which was a very prominent part of my practice at one time, which really just came into being probably in the mid-70s. I think 1976, actually. And that became a very important part of most plastic surgeons' practice.
Was breast reconstruction before the 70s not?
I believe it would have been a terribly uncommon thing, and I can recall the first published case, and it was something that provoked great interest. And now has evolved from fairly rudimentary procedures to some very sophisticated procedures where microsurgery is used to transplant tissue from one part of the body to the breast area after the mastectomy. And there are many forms of reconstruction which start immediately at the time of the mastectomy.
Moving a little bit along the same topic, liposuction has been a very major part in plastic surgery, and many other people are doing it. However, there's talk about using the fat from the liposuction in reconstructing the breasts.
That that isn't anything I ever did, and I read that. It's pretty fascinating. Liposuction came along in the early 80s. It was introduced by a French plastic surgeon to the United States and became a very significant part of a plastic surgeon's practice, certainly of my practice, and continues so to be that way to this day. So it's a very major part of a practice. Using it as an injectable during my time in practice was a very minor part. It was something we would inject into the face for furrows and lines. But today it's a more generally used and in larger volumes of fat. And actually, I'm not that familiar with the techniques in that area.
It's quite interesting. It's a quite interesting evolution of liposuction.
Yes.
How about all this wrinkle caring things like Botox and Restylane? And how safe are they, and how good are they long-term management of?
Well, I think the injectables are very safe. The complication rate is very low. When we're treating wrinkles and lines, number one, there are resurfacing procedures like chemical peels and various forms of chemical peel or dermabrasion. And then there are the injectables, Botox being a very prominent part of that, that's used to paralyze muscles which are overactive in producing lines and furrows. And then there are the other injectables that are fillers. When I was practicing, collagen was the main filler that was used, and it was a temporary remedy, 3 to 6 months. And I thought that was the strength and the weakness of that substance, because if someone was not happy, the result went away. If they were happy, they could have it done again. Some of the injectables today last longer, and they're probably better in many ways. But I'm only familiar with the names of them. I had no experience at all with that, but I did an awful lot of collagen injections.
How about, what was your experience in percentage of men having cosmetic surgery?
Well, apparently the percentage of men has gone up. In my practice, it was always about 10%. And it seemed as the practice grew and the men became more aware that plastic surgery could be done, it still maintained around 10%. I treated more men, but I was treating more patients in general. I found that overall, women were better plastic surgery patients than men are. Men are more uneasy about changing their appearance, even changing their hairstyle. Certainly after the surgery, they weren't as comfortable wearing cover-up makeup while the bruising was still there. So not to say that men aren't good plastic surgery patients, but they find it a little less, probably even today, acceptable. More embarrassed by it, I think, is what the way I would put it.
How interesting, because we're seeing, from what I read, it's a little more, there's an increased number.
Yeah, I think that's probably right.
Men
today,
who
yes,
wish to have that reconstruction. Interesting.
Yes.
What's your experience in plastic surgery in underdeveloped countries?
Well, I was part of a group which traveled to various countries, the Philippines, Thailand, China, and Honduras primarily. And today there are any number of groups which exist. The largest of these groups is Operation Smile, and most people are familiar with Smile. Now, I didn't take part in their trips, but the work is all the same. It's primarily cleft lips and cleft palates and some burn reconstruction. And the reason that this lends itself to surgery in not only underdeveloped countries, but what you could call them underdeveloped operating rooms, because the sterile technique in these operating rooms doesn't match what you were used to in New York or I was used to in Chicago. Very few lips and palates will get infected because of the blood supply to the face. So we could do some significant work without the worries that would go along with working in an operating room, which most of us would find very substandard. But I would say it was, I would say possibly the most gratifying thing I ever did in my practice of surgery.
So you found that this was very gratifying, but what excited you most in your practice of plastic surgery?
If you're talking about a procedure that I got the most satisfaction from, I think a cleft lip in an infant is something that gave me great satisfaction. I would say that if there's an essence of plastic surgery, it would be that procedure, because you're starting with something that is there, it's just misplaced. And by moving these little bits of tissue around, you could produce a pretty normal looking result that allowed an infant and then in the future as an adult to be part of society, whereas in primitive societies they were more or less cast out because of the deformity. So if there was something that gave me the greatest satisfaction, it was that.
That's fascinating. I think we could go on and on talking about the various aspects of plastic surgery and all your experiences with it. But unfortunately, our time is coming to an end, and we're sort of informed of such. I hope that we can come back at some other time and go over some more aspects of plastic surgery and what you have accomplished over the years in practice. I'd like to thank you again for sharing your experiences with us, and to welcome you, hopefully again, in your health.
Thank you. I enjoyed it as well.
Thanks for watching You and Your Health.